So a very good afternoon to you all. Thanks to Joyce again for the very kind introduction. First of all, I have to thank the School of Nursing for inviting me here to have a chance to share with you my experience in research. I'm so happy to see so many of you here. How are you doing? Yeah. So it is part of your regular class? You see? Yes. Oh, so that is very good. Yeah, you are very fortunate. Yeah, to have such a sort of great opportunity. So you can have opportunity to meet nurses from different parts of the world. You have to thank your coordinator. Yeah. So I bring you greetings from Singapore. So for those who have not been to Singapore, I need to point out that Singapore is a very small country at the tip of Southeast Asia. It is a very small country, but it is a very diverse country. So majority of the population in Singapore are Chinese, followed by Malay, Indian, and Caucasian. So you can see all the photos here are very diverse, the same as the society of Singapore. And here I show you some night view of Singapore. And I think Singapore is a very beautiful country. So I hope that some of you in the future may have a chance to visit us, not just to Singapore, but also come to our university and visit our university. I also bring you greetings from Hong Kong. I origin from Hong Kong, in fact. Yeah, I was born and raised in Hong Kong, and then did my study in Australia and also the United Kingdom before I returned to Hong Kong, and now I'm working in Singapore. I also bring you greetings from my university, the National University of Singapore. Have you heard about this university? May not. Yeah. But our university are doing very well. So in this year, we ranked 26th, of all the world-class university. And we are the second in the ranking in Asia, So we are the top medical school in Asia. So do you know which university ranked first this year in Asia? No idea? Who topped us? Yeah, it's University of Tokyo. Yeah. So we are trying to surpass Tokyo next year. Okay. So I also bring you greetings from my department, the Alice Lee Center for Nursing Study. We are a very new department in the university, and we start in 2005 and are meeting our students since 2006. But now we have nursing programs at all levels. So our Bachelor of Science nursing program is a 3-year program. So students can graduate after 3 years and be a registered nurse in Singapore. And for those who have good academic performance, they can go on for 1 more year to get the honors. So honors year is a year of intensive research training. So students have to conduct an individual primary research and write the thesis and before they can graduate. Yeah. So and after they graduate, of course, they can they also work as a registered nurse in the hospital. And we also got Master of Nursing, which is a 2-year full-time program to prepare advanced practice nurse in Singapore, just like your NPs and CNS in the States. Yeah. And then we have a graduate research program, that's Master of Science Nursing and Doctor of Philosophy. So at present in our department, we have about 400 students. Yeah. So I hope that in the future, some of you may come to visit our department. And if you like, you can study your Doctor of Philosophy in our university. Yeah. So what I would like to do today is to share with you my experience in one of my research programs. That is related to mental health care in childbearing women. Okay, and apart from sharing with you the research, I would also like to talk a bit about networking and collaboration. Before I talk about my research program, I would like to say a bit about nursing research development. So we see nursing research activities in nursing, in fact, has expanded tremendously in the past 20 years. And not just in the States or in Europe, but especially in Asia region, especially in countries such as mainland China, Japan, Singapore, Thailand. Yeah. And we can also see that a lot of nurses, and apart from sort of working in the clinical or in the university, they also expand the sort of use the research to influence policy and also healthcare practice. So that is very good. And the expansion in nursing research activities can also be reflected by the number of international journals that we have with impact factor. Okay, so I remember when I sort of first started my nursing career in the universities, we only have 30 or 40 international nursing journals that have impact factor. But from last year's count, we now have 103 international nursing journals have impact factor. So it reflects the expansion of nursing research activities within our nursing profession. That is very good. Yeah. But then we still sort of encounter sort of a lot of challenges in nursing research. So as a researcher, we are constantly being asked to sort of justify ourselves, not just in terms of having more and more research activities, getting more and more research grants, or published in high impact factor journals. We are constantly being asked, so what is the impact of our research in clinical practice and healthcare policy? How do our research projects or studies finding impact clinical practice? Okay. And in order to sort of use evidence to change practice, of course, if we cannot sort of just complete one or two projects and then we ask the clinical, oh, change the practice according to the findings. It's very difficult. That's why it's important for us to have a research program that can generate a critical sort of mass of evidence that can change practice. Okay. Have you heard about research program? Have you? Yeah. So what is a research program? That's a portfolio of research projects on one specific areas. So for example, if you like to study social support, so you have a research program, you use different method, different design to study this phenomenon, and you also create intervention to help to improve social support until you know everything about this concept and also can intervene effectively on these issues. And it may mean that you start from theories to studies, and then from studies evidence, you sort of generate more knowledge to explain that phenomenon. Okay, so that means research project is sort of a group of studies on a certain topic. Okay, and then you know a lot about this topic, and you become an expert in that topic. Yeah. So in order to create a research program, of course, you cannot just sort of doing it in a very sort of casual manner. You need a framework to guide your research program. So this is the framework that I have used in the past more than 10 years to guide my research program. It appears to be a very complicated framework, but it is not. Let me explain. So this framework was proposed by the Medical Research Council in the United Kingdom. It starts from theory to long-term implementation. So if you want to study a phenomenon, of course, then you start by understanding about that phenomenon. For example, social support. If you don't know anything about what's the meaning of social support or the component of social support, it's very difficult for you to conduct a study on social support. So you start with understanding, build up the theory related to social support to explain social support. What is the component? Okay. And after you know the meaning of social support, you may want to find what are the factors that may influence social support, or what are the factors that associate with social support. For example, whether social support can enhance patient outcome, whether social support are related to quality of life. So you do studies to look at relationship among various factors. Okay. And after modeling, then you may ask, how can I enhance social support in my patient? So then you start developing intervention to enhance social support for your patient. And before you sort of go into a randomized control trial, you develop protocol for your intervention. You conduct pilot study, and if it works, then you go to a randomized control trial. So I believe every one of you here understand what is randomized control trial. Yeah, you have learned research. Yeah. And a lot of time, researchers stop after a randomized control trial. But then it's not enough. The last stage is the most important. It's how you sort of incorporate your intervention into routine care practice. There's no sort of meaning if we just conduct a study, publish, and then nothing happened, you know. So the last stage is the most important. Is after you conduct a study, you find this intervention is effective. Then the most important of all is that you try to incorporate into routine practice. So all the patient will benefit from your intervention. So that's why the last stage, the long-term implementation is very important. So that is the framework that I've used in guiding me to develop my research program. And of course, as a researcher, you don't need to start from theory if a lot of theories have been sort of developed to explain that phenomenon. In fact, you can start at any stage within this framework and also spend different duration of time in each stage. So it's a very flexible framework. Okay. And in 2008, the Medical Research Council, in fact, have sort of simplified this framework, but the meaning are the same. So, of course, first you need to sort of develop the theory, and then you go to feasibility or pilot study, and then you go into RCT, and if it works, then you try to sort of put it in a long-term implementation. So the concepts sort of are the same. But as a person that always like old things, I always use the old framework instead of this new framework. Okay. So that's why I would like to use this framework to introduce my research program on perinatal mental health. So you know that having a new baby is always a happy time for the family, is it? Yeah. And but of course, it's also a critical period for new mother because they have to adapt to different changes, physiological changes, and also psychosocial changes. So we know that some mothers adapt very well, so they become very competent mothers and very happy with their experience, very satisfied with their experience. But we also know that some mothers may not adapt so well, so they do not have confidence in themselves, and some of them may develop depression. Yeah, I believe all of you have heard about postnatal depression, is it? That is the depression that is developed after giving birth to a baby. So I started this research program more than 10 years ago. I don't know how well you know postnatal depression. Some 20 to 30 years ago, if we sort of look at the literature related to postnatal depression, in a lot of Western literature, they said that Asian women would not develop postnatal depression. Do you know why? Because you know that Asian women, after they give birth to baby, they usually practice during the month. Have you heard about during the month? That means 1 month after delivery, they are sort of confined to home and being taken care of by female, senior female relatives. And during that 1 month period, there are rituals that they have to go through and special food that they have to eat. We call it during the month. Okay. So the the theory was, because of this during the month, the new mother received a lot of social support from the other family members that protect them from being depressed. Yeah. So that was the theory at that time. Yeah. But of course now we know that it's not true. Okay. So Asian women develop postnatal depression just like any women from any parts of the world. So the prevalence of postnatal depression is about 10 to 20%. Yeah. So of women who recently deliver may develop depressive symptom. And when the time that I start looking at postnatal depression, why I start looking at that? Because at that time there was a lot of incidents happen in Hong Kong that women develop postnatal depression and was not being known and have not received treatment. So they commit infanticide as well as suicide. So there are a few these incidents happen in Hong Kong. That's why it's brought to the attention of the healthcare services. What can we do for those mothers who may have depression? How can we help them? How can we know them and identify them and give treatment to them? But at that time, we know nothing about the experience of women having postnatal depression. We only know that, oh, some women may be depressed, or 5% of women depressed, 10% of women depressed. But we know nothing about the experience of those women who are depressed. So that's why we have to start with trying to know more and develop the theory to explain postnatal depression in women who have postnatal depression in Hong Kong. So we start with the theory. So I start by conducting a qualitative study. So we interview women who are being diagnosed as having a postnatal depression after they deliver. So we interview 35 women and ask them how do they feel when they are depressed, and what are the factors that they perceive as influencing the depression. So this is the diagrammatic sort of presentation of the findings. So women told me that they felt that they are being trapped in their depression with no way to escape. So generally, they felt that they do not know where to find help. They feel helplessness. They felt that they are incompetent. They are tired. They do not know what to do. They are sad. And then what are the factors that influence the mood? Majority of them attribute to the in-laws and also the husband. So you know what happened was that after deliver the baby, the women have to confine at home for 1 month. So at that time, usually the mother-in-law will come in to help the women, okay, to support them. So that was the time that a lot of conflict come in. Yeah. So women said that the mother-in-law invaded privacy. The mother-in-law did not respect them. And so there are also issues related to the gender of the baby. So you know that in Asian country, a lot of time the older generation favor a male baby. But when the baby come out is a daughter, is a female, then there was issue coming in. So the women perceived that the in-law didn't like the baby and also didn't like her because she has given birth to a baby girl. So there was a lot of conflict related to this issue. And on top of the mother-in-law, a lot of women also perceived the husband was not supportive. The husband did not listen to them. The husband did not contribute to the care of the baby. And as the feeling towards the baby is ambivalent, both hate and love. So majority of women said that they love the baby, but they also hate the baby because it was the major reason that caused an unhappiness. So some mother, of course, have said that they have hit the baby, but of course, no mother in our interview actually harmed the baby. Yeah. So they see no way out except by violent means. What does it mean? That means either by killing themselves or killing other people. So many women said that they have thought about poisoning their in-law or their husband because they were so hateful, you know, and or commit suicide and together with the baby. And after the women come to the clinic and receive help and counseling, and they find some other means to escape from the situation. For example, some women said that after doing the month, they may want to get back to the work or divorce from the husband, or when they are unhappy, they know that they have to talk to people. You know. So these are the findings from the study, the first qualitative study that conducted in Hong Kong. And but in our finding, we found that a majority of the women did not know that they have issues until the routine screening found that they have depressive symptoms. And even when we invite them to come to the postnatal clinic, they refused. Yeah, they don't want to have anything associated with depression or with mental health. And so they refused treatment in the clinic, and the family also discouraged the women to come forward for help. Yeah. But of course, those women who are willing to come forward for help, and they found that counseling really helped them to elevate the mood. So this is the first paper that we published from this research. So you can see the collaborator, apart from nurses, the first two authors, yeah, and we also collaborate with the medical profession. One is the professor from ONG, and one is a professor from Department of Psychiatry. And we know that qualitative study were unheard of in medical profession some 10 years ago, yeah. But they are willing to collaborate in this study because they know that it's the healthcare issues that they have to understand. So if you don't understand this postnatal depression, it's very difficult to ask the women, oh, come, you have depression, and please receive treatment. If you know nothing about what's the experience, it's very difficult to persuade them to come for treatment. So that's why they were willing to collaborate in this study. And we are happy, in fact, we are very happy that this is the first qualitative study concerned about postnatal depression that was conducted in Hong Kong. Okay. And after this study, then we asked, yes, we know the experience of women have postnatal depression in Hong Kong. Then would this experience be different from a woman suffer from postnatal depression in Western country? So that's why we conduct another study, is to compare the experience of women who have postnatal depression in Hong Kong and also in Australia. So we collaborate with a researcher from Adelaide, from Australia. So this table demonstrates the comparison of the experience of two groups of women. So we can find that majority of the themes are very common, you know. They feel sad, they have anxiety, they don't know what to do. But in the participant from Australia, we found that they describe the experience have a dual reality. What does it mean? So women said that in a lot of magazine, women's magazine and mother's magazine, the mothers are always so pretty, you know, yeah, with makeup and all that. And the babies are also so happy, smiling baby. But in reality, the baby cry all the time, and they don't know how to deal with that. And in reality, they are in a mess, you know. So then they find there's such a sort of big difference between the expectation and what they experience. And there was also a lot of guilty feeling. They feel guilty because they perceive themselves as not capable of being an ideal mother or perfect mother. Yeah. But whereas in our Hong Kong participants, there are a lot of anger, angry about the mother-in-law, the husband. Okay. And for Australian women, what they did is they try to pretend nothing happened. So they describe as hide themselves behind a mask, so as to pretend everything is normal. Okay, nothing happened. Okay. But when sort of, they found that they may have depressive symptoms or they are being suggested by the healthcare professional to obtain help, majority of the women in Australia are willing to accept help, which is very different from the Hong Kong participant. And the issue of mother-in-law and also the gender of the baby, we could not find in the Australian population. Okay. So this was the paper that we published from this comparative study. And then we further asked the question, yes, so in Hong Kong, majority of the women are Chinese, but you know that Hong Kong is a very special place because it was a British colony for more than 100 years. So we asked the question, whether women who are depressed in Hong Kong have similar experience of women who are depressed in mainland China. Okay, so we conduct another study. So we recruit women from Hong Kong province that is very close to Hong Kong. So we interview the women. So this is the summary of the finding. So we found that a lot of themes generated from this study are quite similar. So women felt that they are exhausted, they don't know what to do, they perceive themselves as incompetent and also imperfect mother. Okay? And the conflict with mother-in-law are very similar, as well as the gender preference. It was more so in mainland China. I don't know whether you have heard about the one-child policy in mainland China. In a lot of major cities, women or a family can only have one child. Okay, whether it's boy or girl, it's one. Okay, so then it makes the gender very important. Yeah, if you have a daughter, you will never have a chance to have a boy because you only allow one child. So the gender preference issue was even more serious in mainland China. So it caused a lot of unhappiness in women. Yeah. And in the China women, we found they also have a very dilemma between the traditional during the month practice with the modern practice, and they also perceive a big gap between expectation and reality. So this is the publication from this study. Yeah. So all in all, from all the 3 exploratory studies, we can come to a conclusion that mother perceived that there's was a big gap between the expectation and the reality. And they were overwhelmed by the experience. They don't know how to deal with. That's why they feel that they are incompetent and imperfect. They felt a subjective sense of out of control. They cannot control their care. They also cannot control the emotion. And especially in Asian women, we found a big issue related to interpersonal and family relationship. Okay, so we have come to the understanding of the theory. And after that, we also conduct a few studies to explore relationship among various factors. For example, we conduct a study to examine the relationship between depression, stress, and social support. So we found that there are very strong relationship. Better social support is related to lesser depression and also less perceived stress. And we also conduct study on the relationship among learned resourcefulness. That means the internal resources that you have, and with social support and depression. So we found that if a person have better internal resources, that means better coping skills, better social support, it also relates to reduce the depressive symptom. And we also test a few instruments that we used in our later study. And we also have a exploratory study on the coping strategies and early motherhood. So with all the studies that we build in the first 2 stages, then of course we ask the question, how can we better help the mothers to prevent depression? Okay, not to intervene after they are depressed. What can we do to help them to prevent or enhance the coping skills so as to lessen the opportunity of developing depressive symptom? So here I draw a house, Yeah, so from our first stage study, we found that mother may not feel that they are competent. They see a big gap between reality and expectation. They felt that they are out of control, and they also have a lot of issues related to relationship. Then the question is, how are we going to help them? So we thought them, if we can prepare them better before they deliver the baby, maybe that is the way. So you know that before delivery some of you may also engage in is that we always have childbirth or education, is it? Is it? Yeah. So majority of the childbirth education that we had in Hong Kong, I don't know here, focus on delivery process, how to take care of the baby, and breastfeeding. But very few talk about emotional issue or coping issue or relationship issue, okay? So then we thought that it's important for us to integrate all these components into our childbirth education. So we call childbirth psychoeducation program. And majority of the program that we have at present, I believe the same as here, is that we do not have a very strong theoretical framework help us to build this program, okay? So we just teach the mother, okay, what will happen in the delivery process, or how to breastfeed the baby. So then that's why when we develop the psychoeducation program, we try to use a theory to support our program. And it is important because if you want to develop intervention, you have a very strong theoretical base. And when we review all the theories, and we found that the learned resourcefulness theory was quite appropriate. What do we mean by learned resourcefulness? That means your internal resources that can help you to cope with the stress. So there are 3 parts. One is sort of help you to adjust your thinking. We call it cognitive restructuring. That means how you change your negative thought to positive thought. Have you heard about cognitive behavioral therapy, CBT? Yeah, so it's very similar to CBT. Yeah, so how you sort of perceive your situation, how you can change your negative thinking to positive thinking. Okay, and the second part is teach the mother problem solving. So when you encounter a problem, for example, the baby cry all the time, so what can you do apart from through a temper tantrum, feeling helpless? So are there any alternatives? So it's problem solving. So the third component is to enhance the self-efficacy. So how can you enhance someone's self-efficacy? How can you do it? If you want someone to be better, feel more competent in yourself, what can you do? So you can give them knowledge, you can teach them how to take care of the baby, and you can sort of ask them to sort of do the return demonstration, and then give them feedback. Okay, so that is efficacy enhancement. So we sort of try to put these three components into our childbirth education. Okay. And of course, some people may ask, oh, the women's sort of problem is related to the gender, is related to the relationship with mother-in-law. Then why don't you bring the mother-in-law in and give them education or change the concept about gender preference? Yes, maybe in the long term, yeah. It's difficult to change the culture of a nation, yeah. But what we can change is how women deal with the issue and how they perceive this issue and how they can sort of problem solve, okay. So we hypothesize that for this childbirth education, it can help to enhance the learner resourcefulness in the mother, enhance the feeling of competence, and as well as reduce the depressive symptom. So then does it work? Okay, it's in theory. Then how do we know that whether it is effective or not? So then we go into the third stage. So we develop the protocol related to this psychoeducation program. We pilot test it to see whether women accept it. And so we have conducted the pilot study. We found that women generally is very receptive to this education program. So then we go into the actual randomized control trial. Okay. So I will report one of the randomized control trial that I have conducted. Is a very brief presentation because of the time issue. Okay. So the purpose of this randomized control trial is to examine the effect of this childbirth education on learner resourcefulness. That means when the mother feel that they have the skills to cope with the issue, the maternal role competence, whether they feel they're competent in the maternal role, and the depressive symptom. And we also want to know whether they are satisfied with the program. So we recruit mother, first-time mother, and Hong Kong residents will be able to understand Chinese because we conduct our program in Chinese, and we exclude those who have past or family mental health history. So this is a consort diagram, illustrate how we randomize. So we assess them and then we randomize them into two groups, and we provide them with education, and we measure the outcome at 6 weeks and also 6 months after the intervention. And you can see that along the way we have some dropout. That means some mother we would not be able to contact, but the dropout was not very high. And we analyze the data according to intention to treat. That means we analyze everybody, disregard whether they drop out or not. Yeah. So just briefly tell you about the measure. So we measure the self-control, that means the learner resourcefulness. We also measure the sense of competence, and we measure the depressive symptom, and we also measure the satisfaction, as well collect some demographic and clinical data. So here are a brief illustration of the finding. So for this one is the learner resourcefulness. We can see the experimental group, and at 6 weeks they have increased in the sense of learner resourcefulness, but we can see that the effect is not really, has not sustained, and it returned to a lower level. But we can see that the control group, that means those groups who did not have the psychoeducation program, in fact have a huge drop of the learner resourcefulness, but later recover. Because you know that at 6 months, more or less mother adapt to the sort of caregiving sort of task and become more competent in that. And this is the depressive symptom. So for the experimental group, you see that they are sort of declined. But for the control group, you see that at 6 weeks, the level of depressive symptoms sort of have a higher level, because you know that for postnatal depression, if mother develop a depressive symptom, usually it will peak at 6 weeks postpartum. Yeah. But after 6 months, then it returned to normal. Okay. But the two groups have significant differences. And for the maternal role competence, we can see that the two groups did not have significant differences. So you can see that at baseline, they are already quite high. And this was after the intervention. And at 6 weeks' time, both groups have a huge drop. That means after deliver the baby, both groups feel that they were not competent. Okay? But then later at 6 weeks, of them feel that they are more competent in this process. So that means from the result, we found that there were significant differences between the two groups in the learner resourcefulness, in the depressive symptom, but we could not find any differences among the two groups in the maternal role competence. So in this study, we can say that, yes, the childbirth education program is effective in enhancing the learner resourcefulness and also reducing depressive symptoms. But for the maternal role competence, we could not find any differences. So perhaps if we really want to enhance the mother's competence, maybe antenatal education is not enough. Because after you teach the mother, just like some of you may have experience of doing this childbirth education. So after you teach the mother, the baby has not born yet. So that means the mother may not have a chance to apply the knowledge that they learned immediately, okay? And they may forget about the knowledge. And after they deliver the baby, so they felt that they do not know what to do, okay? But 6 months after, they pick up their skills. So that's why we thought that it may be good if we can have follow-up at the postnatal period. And when we interviewed the mother said that the most helpful strategies for them is the use of positive self-talk. That means you constantly reinforce yourself. Yes, I'm competent, I'm a good mother, I'm capable of doing things. That is positive self-talk. They regard these strategies as very useful for them. And also the problem-solving skills that we taught them during the psychoeducation program was also perceived as useful. And the mothers also comment that the learned resourcefulness concept, in fact, is quite fit into the Asian culture. Because in Asian culture, we always think that, yes, if we have issue, we need to deal with them ourselves. Yeah, not seeking external help. And in this learned resourcefulness, what we encourage the mother is that we teach them skills. So in case if they found that they have issue, they can use problem-solving skills to help themselves, and also use positive thinking to help themselves. Okay, so they found this concept quite appropriate for them. Okay, so we complete this study. Then we publish. Yeah. So what comes next then? So remember, in our first stage, we also conduct a qualitative study in mainland China. So we found that what are the ways to help people with in mainland China? So we conduct another RCT in mainland China. So in this, because in our qualitative finding, we perceived, or we found that for women with mainland China, the relationship with mother-in-law and the gender preference was such a huge issue. So we try to adopt an interpersonal psychotherapy framework to help the mother. So that means basically we help the women to enhance the ability to deal with the interpersonal issue and to how to cope with the interpersonal relationship. So again, we conduct a randomized control trial. And we found that the program was effective both in enhancing the interpersonal relationship as well as the sense of social support. So that is one of our publications. And we found that the education program also can sustain a 3 months follow-up. Okay, so we have conducted 2 randomized control trials. Okay, so we found it's positive. Then what are we going to do with the findings? So that is from effectiveness to implementation. The last stage is the most important. Okay. So when we conduct our RCT, randomized control trial, we partner with our clinical colleagues, both the medical profession as well as the nursing profession. So we come together to develop the intervention. So that means the intervention that we developed are acceptable by our clinical colleagues and they feel is appropriate. So that's why after we sort of finish or complete our study, our clinical colleagues are very willing to incorporate the intervention into the routine practice because first of all, they feel there's a need. That's the most important. They feel there's a need to enhance the service for the mother. Okay? And the second is that we develop the intervention with them. So they feel that the intervention is belong to them. Okay? Not because I'm from the university, I develop an intervention and I ask you to sort of adopt it. It's very difficult. So they feel the intervention belong to them and is appropriate and acceptable by them. So that's why they are very willing to incorporate the intervention into the routine care after the intervention. Okay? So we sort of feel that it is a very successful sort of program because at the end of the day, we are able to incorporate our research evidence into the practice and be able to make a difference in the practice. Then what are the sort of further development after this? So, and after that, all this study, I moved to Singapore. So I continue my research program. So we conduct a sort of a few exploratory study in Singapore and looking at the postnatal experience and social support and self-efficacy and social support. And we found that in Singapore, the problem that women encounter was no different from women in mainland China or in Hong Kong, very similar. And, but you remember that in Hong Kong, so all the intervention that I've sort of developed are antenatal sort of education program. So in Singapore, we sort of thought that yes, antenatal education is important. How about if we can develop something that we can sort of help the mother after they deliver to provide continuous support to them. So that's why we sort of in the Singapore study, we developed a postnatal psychoeducation program. So this postnatal psychoeducation program consists of education session as well as a follow-up visit to the mother at home and also telephone follow-up. So we conduct RCT again and we find it sort of very positive in terms of the sense of social support and self-efficacy of the mother. So we publish our manual and now we are sort of waiting for we have already sort of sent our publication to a journal and is waiting for the review and hope that we can sort of publish this RCT very soon in International Nursing Journal. So all in all, what I found that is this research framework is very useful to help me to guide my research. And I believe it is very helpful, especially for early sort of beginning researchers. So when you sort of engage in a topic or an area of research, it is very important for us to know what is the stage of knowledge development in this topic. And then you can sort of try to follow a framework to develop your program of research. It is very important in a way as a researcher, you need to develop your expertise, you know. You don't want to sort of research in one area for this year and then another area for another year. So you never be able to develop your expertise. And I found this framework very useful for me as well as for other researchers to follow in order to develop your expertise in sort of your area of research. And so I just completed this study. So it's related to sort of childbirth or midwifery. So this is an international study to study job satisfaction and well-being among nurses, midwives who work in the sort of obstetric setting. So you can see it is an international collaboration with partners from Europe and also from Korea. Yeah. So we have just completed this study, and we are now sort of analyzing data. And I hope that in the future, I can report to you the findings and also publish in international nursing journals. Okay. In order to develop research, and it is important that the research that we conduct must be able to meet the healthcare needs. It's no use to conduct something that's not an issue in the healthcare setting. Our research must be able to generate new knowledge or generate new solution in healthcare, just like my program of research in perinatal mental health. Why I start this research program? Because that was a need in the clinical area. Yeah. So the intervention that I developed are able to solve a problem in the healthcare service. And the intervention that I developed are able to be adapted by the clinical setting as a routine practice. So that is very important. In the future, if you sort of have to conduct a research, and you have to sort of really look into the the actual healthcare services, the clinical practice. What are the issues? What are the clinical questions that you would like to ask? And what are the clinical problems that you would like to solve? And in order to help to build the evidence, it is very important that we have interdisciplinary collaboration. That means not just conduct a study by nurses yourself, you have to collaborate with other professionals in order to build the evidence and in order that your intervention can be incorporated into routine practice. And it is very important that for university staff, just like me, a faculty, to collaborate with our clinical partner in order to build something that is really can solve the clinical problem. And of course, in order to generate evidence that can change practice, not just in your local setting, but also you would like to influence the regional development or international development. That's also very important for you to collaborate with your colleagues in the region and also internationally. And how to generate this relationship. And from my experience, there are some strategies that I have used before. For example, between universities, we can establish faculty and student exchange. So at present, in my department, our students have exchange program into more than 10 countries in the world. So I hope that in the future, you can also have an opportunity to come to Singapore for exchange. Yeah, so through exchange, through discussion, we may generate our agenda for collaboration. And it is important for us to participate in international conferences or organize international conferences so we can bring in colleagues from different parts of the world and we can discuss our research agenda and our research development. And involved in international professional association, of course, is important so we can have exchange with colleagues from other departments. So all in all, I hope that in the future we can explore opportunities for research collaboration and through various methods. And some of you may not know that Professor Procini, in fact, is our visiting professor in the department. So that's how our research collaboration or our education collaboration start. And we look forward to other collaboration apart from our Master of Nursing program. And I also welcome faculty and students come to visit us in Singapore. And we also hope that our students will have opportunity to visit you in your university. So that's the end of my presentation. I would like to thank all of you again for your listening. And my husband is here, okay? So we had a trip to Grand Canyon in June this year, in fact, yeah. So again, thank you so much for inviting me to come over here to share with you my research program. And I really look forward to our future collaboration. So thank you so much. And questions and comments are welcome. Thank you. Yeah.
Wonderful presentation. We'd like to take some questions, but Bing Su Cheng, Dr. Chan's husband, is a nurse, and he works in the Ministry of Health in Singapore. So it's important for, please stand up and
yeah.
He's right here. So, we have a dynamic nursing couple here. Please some questions.
Yes.
What do you find to be the most challenging part of research? It seems to me like from the beginning of your idea to your actual implementation, like how many years was that? And do you find that, it's that part being frustrating, not having like an immediate impact on like a day-to-day operation of?
Yeah, thank you for the very good question. Yeah, research is always challenging, and things are always not turn out as you planned it. Yeah, and so this research program have been going on for more than 10 years, So we spent a few years in our first two stages, the theoretical and the modeling, and then we continue to build our intervention. So we take 2 to 3 years to sort of complete our RCTs, and then the later implementation. So it's, I think the process tell you that research is not a short-term process. It's a long-term investment. If you want to understand an issue or develop knowledge, it's not just 1 or 2 years. You need a few years to actually study the phenomenon and understand the issue and to build the intervention. So patience is very important. You cannot try to achieve everything within 1 year. So you need long-term planning. And of course, in the day-to-day conduct of research, you need to collaborate with a lot of people. Yeah, especially for us as clinical researchers, it's very important for us to collaborate with our partners in clinical. That's why when you generate your research question and look into the research problem, you need to work closely with your clinical partners to generate a research question that's appropriate, that is needed by the healthcare services. So you continue to work with them throughout your research process. It is very important because if you don't have the support from the clinical partner, it's very difficult for you to conduct research in clinical. Because we are working in the university, we do not have a clinical service, So we cannot go into our clinical setting and say that, yes, I want to conduct a study. Please give me access to your patient. No one will do that. Okay? So that's why you need to work with the clinical partners, develop the proposal, engage them in the whole process. And in fact, I consider myself very lucky. And I got clinical partners who are willing to work with me. But I guess it's both sides, because you show your sincerity that you are willing to work with other people, and you demonstrate you are committed and motivated in the project, and you are there to help to solve a clinical issue. So they are willing to work with you. And of course, along the way, you have to develop your credibility and gain the trust. So with trust, then we move on together. We conduct the RCT, and after the RCT, we provide evidence to support the intervention is effective and the intervention that we build together. So it's very logical that they incorporate the intervention into the routine practice. So yes, research is a long process. You cannot get your immediate gratification. Yeah, you need to be very patient and work closely with your team. Yeah, because in a research team, we need expertise from various settings. Apart from clinical, you may need someone who are very good in statistics. You may need someone who are good at other things, So you need to work with your team. Yeah, work with them, build up your credibility, gain the trust, and then move forward together. Thank you.
I know that finding funding can be very difficult as young potential researchers that are maybe wanting to get into the research field. What would your recommendation be in terms of cultivating and sustaining funding sources and grants and that kind of thing?
Yes, I agree. It's very difficult for a beginning researcher to get research funding because you don't have the research track record. So that's why it's important to work in a team. So in a team, you got experienced researcher that can support you in the grant application. So for the grant that I had in my first qualitative study, it's more than 10 years ago. At that time, I still was early beginning researcher. But I work with team members, so you can see the team. We got the chair and professor from ONG. I also partner with more experienced researcher, Professor Valerie Levy at that time. So this partnership provide me with sort of strong support to apply for a grant. So that was a funded project by Health Services Research Grant. So work with experienced researcher so as to provide you with the expertise that you don't have. No? And then all along you need people to support you. So you have to identify, I think when you build a team, it's very important that you have to identify who are the suitable person in your team member, not your friends, you know. Not just ask your friend to be in your research team. That may not be useful. Ask someone who got the background to be in your team. That's very important, you know. Find someone who are good at the subject matter. Find someone who are good at the methodology. Find someone who are good at statistics if you're conducting an RCT, and find someone who are strong in clinical, as your clinical partners. So that is what the research sort of grant committee will look at. So build a team is important as a beginning researcher. Thank you. Yes.
I wanted to ask you a question about your qualitative research. It appeared that a number of the things that you asked were kind of sensitive, and so I wonder if there was any challenge in eliciting that kind of information from.
Thank you very much. So I think it's a very important question, especially when we deal with a sensitive issue, for example, depression and all that. And that's why the skills of the researcher is very important. When you sort of interview the women, it's not sort of sit down and then tell me about your depressive symptom. It will not work, you know. So you have to develop a good relationship with the mother. That's why we sort of, before with the actual interview, we sort of met the mother and have a sort of informal chat with them, talk about the baby and all that to build up relationship. And then we sort of make an appointment to interview them. And depression is a sensitive issue, and it's not sort of really cultural in a way that women sort of are willing to talk. But that's why the researchers has to be sort of very experienced and very supportive in a way, so as to encourage the mother to talk about the experience. And of course, we have to explain to them everything is confidential, you know. And the identity will not be revealed, and what they have said is we will not communicate with the doctor or the mother-in-law or the husband, all that. So I think we sort of have to do all this sort of explanation. And but at the end of the day, I believe it's still sort of the relationship between the researcher and the interviewee is important. And also we sort of inform the mother why we have to conduct this study. We conduct this study because we want to understand them more so that we can develop intervention to help them. And I think this idea is very appealing to a lot of mothers because they felt so helpless in the past. Nobody helped them, nobody understands them. But there is someone who come and willing to listen to the experience. In fact, a lot of mothers said that after talking to us, they felt very relieved because it's like very therapeutic. To talk to us. And I guess it's you need to have a very strategies. Explain to the mother why you need to understand the experience. Explain the benefit of this research, and explain to them the confidentiality involved, and try to build a good relationship before the actual interview. So, and from all the qualitative study that I've conducted, I think these strategies are quite helpful. To help the person to sort of encourage the person to share the experience with us.
Did you use several interviewers or just one?
So for this, we interviewed, we met the women twice. So the first meeting was to build a relationship and to show our care to the mother. So we asked them about the baby and all that. And then the second meeting was the actual interview. We sort of call some mother to clarify the issue, but we did not sort of interview them again.
Sorry, but was it just one interviewer, meaning?
One interviewer, So one interviewer, because we want to maintain the consistency of the interview. So we have a very experienced nurse, so we train them to do this interview. And I guess in this sort of issue, it's very important to have an experienced researcher. because we also sort of foresee that if the mother in the middle of the interview, the mother may cry, break down and all that, so the researcher has to know how to sort of manage the situation. Yeah. So we also sort of foreseen that, but it actually did not happen, is that during the course of the interview, if mother sort of disclose some suicidal thought, and then we have to deal with that. So that is why it's also important that the researcher sort of are being trained to do so, how to handle the situation.
Thank you. How did you find your patient pool?
Yeah, for the study, you mean? And we work with the clinical sort of partner. For example, for the first qualitative study, we recruit them from a clinic, a postnatal depression clinic, which the psychiatrists refer the mothers to us. And for the other study, so we conduct in the hospital, in the because in hospital they got routine childbirth education, so their mothers coming forward. So we sort of recruit from the pool, and randomized it into sort of two groups. Yeah, so it's mainly from the clinic and the hospital. Yeah.
Was there any kind of payment or reward baby gift?
No, not for the study that we conduct in Hong Kong. And in Singapore, we it's not payment, it's just a gift, you know. So we buy sort of, it's not expensive, it's several sort of 5 Singaporean dollars and some sort of baby gift sort of to the mother. Yeah, but there was no payment involved. Yeah. Yes.
So as you think about what you've learned, what else might you include? Are there other interventions that you as a research team have considered? Are there any quantitative studies that you've considered doing, like in terms of studying whether or not the rate of suicide among postpartum mothers has gone down, or any other things like that? Have you tried to expand this to the broader population?
Yeah, I think what if I have a chance to continue this program of research, I think sort of longer term follow-up is important, because so far the longest sort of time that we follow up the mother is 6 months. Okay, so if the funding is available, of course we want to have a longer term follow-up to the mother to see the longer term outcome of the study. So far, my study is that either is antenatal or postnatal. I have not sort of conduct any study from the antenatal to the postnatal support and then longer terms of follow-up. So if I have opportunities, I would really like to sort of develop an intervention so we can do it from antenatal stage up to postnatal stage and then longer term follow-up for the mothers. And of course, it's also related to funding. So you know, in sort of healthcare research funding, usually it's 2 to 3 years. So it's very difficult to have a longer term follow-up in a way. But we can sort of consider various options and to see how we can sort of build in this longer term follow-up. Yeah, thank you. Yeah, maybe, yeah.
Has there been any studies on the infants, sort of like the long-term mental health status of them when they're potentially exposed to like stress hormones and breast milk, whatever, and how that impacts them, which may lend credence to the need for an intervention?
I have not conduct sort of outcome on the baby, but then previous studies sort of found that sort of for mother who are depressed, so in fact it would affect the sort of longer term development of the baby, both physically and psychologically. Yeah, so that is the evidence that we have. But for myself, I have not conduct any sort of study related to the baby outcome.
And because there's less nursing qualitative research, it's always interesting to hear about how you come to the parameters for your study and what you choose to include and exclude. And I think you said that you excluded people with a history of mental illness. It seems like in a society that has a stigma for mental illness, where people are less willing to get treatment, it would be hard to differentiate. Or can you talk about why you decided to exclude that?
Yes, for the RCT, because we want to sort of, because if you want to examine the effectiveness of an intervention, we try to avoid sort of factor that may affect the effectiveness of an intervention. So for example, if the mother already have sort of a history of depression or schizophrenia, and if you give them intervention, of course the outcome will be very different from mother who do not have such a mental health history. So that's why in the randomized control trial, we exclude those who have long history of mental disorder. Of course, if unknown, we will never know, you know. Yeah, so that is the best that we can do. But of course, when we come to the long-term implementation, yeah, then you will provide the intervention to anyone, you know, and you disregard the background or whether they have a long history of mental illness or not. But in a research setting, it's important that we can control some factors so that the outcome measures that we have will be meaningful. Because if you include too many, we call covariants in our study, it's very difficult for us to come to a conclusion. So that's why we conduct our RCT in a more controlled setting. Yeah. So that's why the longer term evaluation is important. So that means after you incorporate your intervention into routine practice, it's not full stop, you know. You have to still continue to monitor the outcome of the intervention and continue to improve the intervention in order to be to make it more appropriate for your target groups.
And I saw that in one of the last studies that you posted, you did research on nursing job satisfaction in terms of midwives. Actually my classmate here and I are actually looking at factors around job satisfaction and well-being in nursing retention. So can you talk more about that and why you chose to look at that after doing so much research on the practice and in terms of the mother and baby?
Yeah, so this is the study, in fact, is not initiated by myself. It's initiated by one of the partners from Czech Republic. So that she was the principal investigator of the study. And why they come to me and ask me to involve in this study? Because I got a lot of publication in this area. And, but I think it's very logical. Yeah, I have conduct a lot of study on mothers, and yeah, I think it's logical to have some study on nurses working with the mothers. And that's why I was involved in this international study. And so we measure the job satisfaction and psychological well-being. So we measure the psychological well-being, measure depression, anxiety, and the job satisfaction. And we hypothesize that for people who have better job satisfaction, of course, they will have better psychological well-being. And in our Singapore data, it supports that. But we, because we have not really complete all the data analysis from other countries, so that's why I do not know the international studies result. Yeah, I only know my own country's result at this point of time. Yeah. So, so I hope that in the future I will be able to share with you, and we are aiming to publish this study maybe in a year's time. Yeah, so I hope that you may be able to read the result of this study very soon. Yeah, thank you. Okay, thank you so much for all the questions.